This Good to Go segment is made possible by Spectrum Health Medical Group.
September is National Ovarian Cancer Awareness Month. All women are at risk of developing this disease, but some have an increased risk due to genetics, family history, or their own medical history. Now, ovarian cancer can go undetected until it has spread to the pelvis and the abdomen, which remind us that being aware of changes in your own body is extremely important. Dr. Zakhour is joining us today to tell us what we should be looking for and what steps we can take. Good morning.
Good morning.
Okay, so what are some of these things that we should be looking for as far in our own body, some of the changes?
So some of the symptoms and signs of ovarian cancer are actually quite subtle and vague,
Okay.
and so they're often overlooked by women. But the things that women should be looking for are bloating or abdominal distension, abdominal or pelvic pain, feeling full quickly or not having much of an appetite, and sometimes urinary frequency and urgency. So those are the symptoms that we typically associate with ovarian cancer.
Okay, now bloating, that's something that can happen a lot or at different times of the month. So in what scenario is, okay, this might be something a little different, something that I might want to check
so
out.
bloating that's out of the ordinary, so a
Okay.
symptom that a woman has not had previously, that usually lasts for several days to weeks,
wow, okay.
usually about a third of the month. And so something that a woman has not had previously and is lasting longer than you would expect, based on eating something different. Or, those are symptoms that really they should report to their physician.
Okay, and so now, yes, exactly. If you have some of these symptoms, you're wondering, this might be something I want to go check out. What's kind of the next step?
So the next step, if a woman does have some of these symptoms, is to report to their physician, preferably a gynecologist.
Okay.
A gynecologist can do a pelvic exam, both an internal and external exam, and many women mistakenly think that pap smears are actually detection tests for ovarian cancer when in fact they're screening tests for cervical cancer.
Okay.
And so, so a pap smear will not detect ovarian cancer, but what your gynecologist can do is perform a pelvic exam to detect an ovarian mass, possibly order a pelvic ultrasound to look for an ovarian mass.
Okay, and now if you do have that cancer diagnosis, normally when you're talking to people, they'll say, oh, it's staged, whatever. Can you tell us a little bit more about the different stages and, obviously some treatment options depending on, what your diagnosis may be?
So staging of ovarian cancer is done surgically, and stage 1 is generally treated with surgery, and some of these women will additionally receive chemotherapy after surgery. Stage 1 is confined to the ovaries. Stage 2 and 3 is treated about the same with surgery followed by chemotherapy, and stage 4 is advanced disease outside of the abdomen and pelvis, and that's generally treated with either surgery up front, or now we're doing something called neoadjuvant chemotherapy, which is chemotherapy given before surgery. And those women will have their chemotherapy followed by surgery, followed by additional chemotherapy.
Okay, so it sounds like, regardless of what your diagnosis is, there's still a lot of options.
Right, there is, and there's different ways we're giving chemotherapy now. Giving chemotherapy before surgery in patients with advanced disease helps kind of shrink the tumor burden so that the surgery is less extensive and patients can recover a little faster.
Okay. Now, as far as, family history or own medical history, that can come into play. Maybe some women that are at higher risk, what are some options for them?
So women who are at higher risk of ovarian cancer can report to a genetics counselor. At Spectrum Health, at our cancer center, we do have genetics counselors who can kind of tease through the family history to determine what your risk really is.
Something that you need to have.
And they can also recommend genetic testing if it's indicated in patients who do have a strong family history of breast and ovarian cancer. In women who are at baseline risk, the only chemo prevention or medicine that we can give to decrease the risk is birth control pills or oral contraceptive pills. So using birth control pills for 5 years decreases your risk of ovarian cancer by about 50%.
Wow.
Absolutely.
Wow. Okay, so what are some other ways that you can prevent ovarian cancer?
So really, aside from being aware of your family history and knowing if genetic testing is indicated and birth control pills, generally just a healthy diet and maintaining a healthy weight prevents several kinds of cancers and likely ovarian cancer as well. But those are really the main things for prevention.
Wow, definitely an important subject, and want to make sure that during National Ovarian Cancer Awareness Month, you can learn more about the warning signs and preventative steps. You can head to Spectrum Health's website. We've put a link on our own website at WZZM13.com. Thanks so much for joining us. Have a great afternoon.